UNICEF is warning about a drop of confidence levels in the importance of childhood vaccines in more than 50 countries. Between 2019 and 2021, the annual number of unvaccinated children rose from 13 million to 18 million globally, and that's an increase of more than a third from before the pandemic. And while most Canadians still say routine vaccines are important during childhood, that level of confidence has dropped from about 90 to 82%. David Morley is the CEO and President of UNICEF Canada. David Morley, welcome to the show.
Thanks very much, David.
So Canada had a drop in its trust in vaccines. How concerned are you about these changes?
I'm very concerned. Even though the drop seems that it may not be that big because we still have 82% of Canadians feeling confident about vaccines, but a drop in just a couple of years from 90% of the people being confident down to 82, that's a real concern. And it's a concern because really over the last 30, 40 years around the world and in Canada, nothing has done more to save more children's lives than routine childhood vaccination programs. So if people start to get concerned, hesitant, doubtful, don't think that they work, that does not bode well for what could be coming next.
Right, and this isn't necessarily the COVID-19 vaccines, which have been an enormous political challenge in a lot of segments of population. These are your standard kids vaccines, right? Your measles, mumps, rubella. Yeah. Trust is declining there. I mean, what are the health population consequences of even a drop from 90% trust to about 82%?
Well, I think we can assume that what is going to start to follow that is a lowering rate of childhood immunization here in Canada. And that's going to mean that some of those diseases that a lot of people have forgotten about are going to come back. We've seen in some jurisdictions in the United States, in New York State, for instance, that measles are coming back. We've also seen polio in New York State. So as this hesitancy continues, there's a risk that, a very likely risk that fewer kids will be vaccinated, and that means that more kids are going to start to get sick. And it doesn't make much sense to me because, as I say, what we at UNICEF have seen over the last generation is an incredible decline in deaths in under 5-year-old children around the world. And the main reason is because of immunization programs.
You know, even prior to the COVID-19 pandemic, we saw vaccination rates in Canada were kind of stagnating. So how much of this drop do you blame on vaccine hesitancy and misinformation around COVID-19?
We you know, in the survey that we've done, the global survey, we haven't gone into all the depth of that. But I do believe, and I think that we see this at UNICEF, that the discussion around vaccines that happened during the COVID pandemic means that there's more and more misleading information out there about COVID vaccines, and also then it sort of transfers over into the routine childhood vaccines. It became a topic of conversation during the pandemic, and unfortunately, that means that there's more misinformation floating around.
And there's an interesting generational component to this, right? Because in most countries in your survey, including Canada, it's people under 35 who are more likely to report that they had less confidence about vaccines for children after the start of the pandemic. What do you take from that, the youthful tilt of this data?
Well, that's very concerning too. I suspect that people who are older than 35 or people of my age who can remember when diseases like measles were around, or we have our parents can remember when people were afraid of polio, rightly so. But for the under 35s, I think in so many countries, those childhood diseases have become a thing of the past. People have forgotten about them. They've forgotten that vaccines save lives. And so it becomes something that they're not thinking about in the same way. And that's very concerning indeed.
Now, there was a disruption, of course, in normal vaccination processes caused by the pandemic. You know, flu clinics weren't open necessarily. Kids' vaccinations, they weren't available because public health resources were tilted to dealing with the urgent crisis caused by COVID-19. What kind of a catch-up do we need to do here? And What's the policy solution to build that trust back rather than see it keep declining?
Well, it's not only a policy solution, David. I think one of the things that we saw work during the COVID vaccines rollout here in Canada was our health leaders were talking to community leaders. They were going out to the community, talking to different leaders, religious leaders, community leaders, to explain to them how important vaccinations are. And then with the support of those community leaders, then the community came along as well, a community that maybe doesn't always trust what the official government says. So we need to undertake more of that kind of community engagement, I think, to be able to be sure that otherwise forgotten or marginalized communities here in Canada will do will be participating more because they'll feel more confident when their leaders are reminding them it's not just what the official government sources say,
Right.
but rather what community leaders say.
Just as a final point, if we can go big picture, you said that with the rise in vaccination, UNICEF has noticed a dramatic decline in deaths in children under the age of 5. But this reduced confidence in vaccine, it comes on the heels of 67 million children around the world missing out on vaccination during the pandemic. I mean, what are the implications of that globally?
I think the implications are that for the first time in 60 years that we've been measuring the under 5 deaths, they're going to start going back up. For 60 years, every year, fewer children have died than the year before. But with this number of children missing their vaccines, more children are going to die.
David Morley, I wish we had a happier note to end the conversation on, but I want to thank you for your time today.
Thanks very much, David.